I'm Antoni Chan. I'm reporting here from London at EULAR 2026. And there have been a lot of interesting abstracts and presentations today in the field of psoriatic arthritis. And I want to highlight to you an interesting abstract that was just presented. I've just come out of the session right now. It's oral presentation OP068. Now, we've all been here before. We have done psoriatic arthritis clinics. We've examined the joints. There is nothing swollen. There's nothing that is tender, but the patient still reports having pain. Um, is there any inflammation there? What can we do if we can't see it? And I think today we had some interesting result from this presentation. The study comes from India, and it's using gallium-68 PET scan. Now, what's interesting about this is understanding the molecular signals behind this presentation where patients are complaining of pain when we can't see it or feel it when we examine the patients. So this is a study where they looked at the use of gallium-68 PET scan to look for inflammation in patients who clinically didn't have any tender or swollen joints. Now we know that in psoriatic arthritis, there is a subclinical inflammation that can happen where there's inflammation but maybe not visible or not something that we can examine. And what happens is there's synovial angiogenesis, so new blood vessels being formed, which is the early pathogenic event in psoriatic arthritis. And often this precedes the onset of joint symptoms. We know that there are cytokines, VEGF, TNF alpha, IL 17, and also an important integrin, which is alpha V beta 3. Now, in this study, the gallium-68 PET scan is able to detect the alpha V beta 3 integrin. In this study, they had 15 patients with psoriatic arthritis, and in total, they examined around 1,020 joints, so a lot of joints. Now, what is interesting is that they found that in 52% of these patients, the PET scan lit up, as in the PET scan was positive, but the examination was negative, as in there were no tender or swollen joints. So these were clinically quiescent in this group of patients. There was good correlation in terms of the examination finding and the negative examination finding and the positive PET scan, and also the PET scan results correlated with DAPSA, with swollen joint count, CRP, and also the NAPC score, the nail score. Now, I think what we're saying here is that the PET scan is not yet going to be used in our clinics. We certainly would not be using this routinely in our patients. But what is telling us that there is this concept of subclinical inflammation that can be seen using other imaging modalities such as this gallium-68 scan compared to our traditional examination, where we know that in psoriatic arthritis, damage can happen as early as 6 months in early disease and uncontrolled disease. So they also were able to use latent class analysis, where they found that there are patients who are very PET positive. So these are patients who they call PET predominant, where the scans were positive, but clinically they were found to have no tender or swollen joints. And these were in 35% of patients with positive joints, where they actually had 100% PET positivity, but 0% clinically tender joints. Now, what does this all mean to us? I think it helps us to dissect the molecular imaging of angiogenesis a bit more, and this perhaps one day could serve as a way for us to identify and detect psoriatic arthritis earlier, and perhaps start treatment a bit earlier, and also to monitor the response, certainly in this early phase of disease. So in PSA, I think what we are saying here is that the, the clock starts much earlier than we think, as in we can examine the patients, but in fact the inflammation and the angiogenesis might be happening much closer and much earlier than we think. So I think this adds to our understanding of the importance of this pathological process, namely angiogenesis, and how more detailed scanning, such as the 68 gallium scan, hopefully in the future might be able to help us to detect these conditions much sooner. I'm Antoni Chan reporting for Room Now here at EULAR 2026 in London.